and gentlemen of Gousse Urology Show. My name is Dr. Angelo Gousse. I am a board-certified urologist, professor of urology, specializing in sexual function and bladder dysfunction. And I'm here to basically educate the community about certain urologic disorders that are very common. Either they have affected you, or they might eventually affect you, or maybe you know someone who's been affected by the disorder that we're going to talk about. And this Gousse Urology Show will talk about various urologic conditions, and hopefully you will find it extremely informative as we try our best to keep it in layman term and give you a significant amount of visuals in order to put things in perspective for you, because I realize that many of you do not have a medical background, and many of you won't understand all the details. Nevertheless, the information is very useful to all of you watching the Gousse Urology Show. Today we're going to talk about a problem which affects approximately 40 million men in the United States. More than 50 million women are also affected by this problem. I just wanted to make this point because more women are affected by the problem I'm going to talk about than actually men. However, they talk about more how it affects men than it affects women. And that's one of the points that I wanted to make in this show. And I'm going to talk about sexual dysfunction. Sexual dysfunction is a common problem. So what it is the couple or the individual is dissatisfied with the performance of the sexual activity, of the sexual experience. That's essentially, in a nutshell, what sexual dysfunction is all about. Let's talk about briefly, we're going to talk about female sexual dysfunction. Female sexual dysfunction starts early on. It can start at a very young age. And there are many domains in sexual dysfunction in the female. And one of the conditions, which is a natural progression of aging, which causes sexual dysfunction in female, is menopause. Genitourinary syndrome of menopause has a significant impact on female sexual dysfunction. And one of the main impacts in the female is related to hormonal changes. And one of the hormones which is extremely important for female sexual function is estrogen, which is significantly diminished or almost goes to zero in female sexual dysfunction patients. So it's important to understand the importance that estrogen itself plays in sexual dysfunction in the female. It decreases libido, it decreases secretion of the vaginal tissue, and this is a model of the female genitourinary anatomy. The female genitourinary anatomy entails the vagina and the bladder and the rectum and all that. And when there's lack of estrogen, the vagina starts getting dry and the introitus starts getting narrow, and its painful sexual activity can become a big problem, and this will affect sexual function. In addition, the clitoris gets less blood flow, and the clitoris in the female is an organ that plays a vital role in sexual function in the female. Therefore, it is possible to restore the estrogen milieu, the estrogen environment in the female, in many cases, just by prescribing local estrogen therapy, such as vaginal estrogen cream. Now let's talk about vaginal cream, estrogen vaginal cream. Estrogen vaginal cream has gotten a very bad reputation in the general population. But if you look carefully at the scientific evidence, there's very little evidence, if any evidence, that vaginal cream, estrogen vaginal cream itself, is harmful to the patient. So I feel personally, I'm going to go on a limb here and say it on the media, that I feel a lot of women have been deprived of adequate treatment of their genital urinary syndrome of menopause unfairly, because they're saying it's dangerous, it can cause breast cancer, blood clots, this and that, where there's almost no evidence it's the case. For one thing, the vaginal cream itself stays locally and therefore doesn't migrate. It doesn't migrate in your bloodstream. So that affects libido. The estrogen, when you don't have enough estrogen, it affects your desire to have sexual activity. So the libido of these women can be affected. They have more painful intercourse called dyspareunia. And then their clitoral blood flow is diminished. All these things need to be addressed. All these things need to be restored. Too many women are suffered in silence. They're suffering in silence because their sexual dysfunction has not been addressed. We're going to talk later on the show about a potential solution for women who have these disorders, and we can restore blood flow. We can restore a better vascular and neurovascular status of the genitalia with a procedure, with a little injection that you can put in the vagina called the O shot. The O shot. And we will talk about that. The O shot stands for orgasm shot because it increases orgasm in the female. So we're going to take a break a little bit. Out of respect for the women, I discuss female sexual dysfunction first because it is more prevalent. It affects a wide range of age of women, from 20 to all the way up. And the younger women, it can be because of, prior bad experience, unfortunately, a rape or trauma. All these things, psychological trauma, all these things can affect sexual dysfunction in a woman. I think more research needs to be done. People need to talk about it more. Female sexual dysfunction, which certainly we address at Gousse Urology. Now let's talk about male sexual dysfunction. Male sexual dysfunction, let's be realistic, there is more information on male sexual dysfunction than on female sexual dysfunction. It's a fact. But let us talk about it. One of the most common cause of male sexual dysfunction is erectile dysfunction, inability to have a proper erection. But there's more to sexual dysfunction in the male than erectile dysfunction. There's more into it. And one of the things that can happen is that some men also can have problems with libido. They don't have enough desire to have sexual activity. And one of the reasons is because their testosterone level might be decreasing with time. The same way there's a condition in the women called menopause. As they're getting older, in their 40s, in their 50s, even in their 60s. But in the male, after age of 40, there's a drop in testosterone level that can occur, sometimes precipitously. And these men will feel tired. They don't have the same level of energy. They can't focus the same way. They're sleepy. They don't feel their selves. And they don't have the same erection. They don't have the same sexual abilities. And often it's because of sexual dysfunction. It's because of testosterone is too low. And it's possible to test in the blood a testosterone level. You just do a blood test. You check the testosterone level just by in the blood, just like that. Take a needle, you put it in the arm, take the blood, you send it to the laboratory, they check the testosterone level, you know your testosterone level. It's like an automobile. You need to know what is the level of your gas tank. You need to know how much is in your tank. If your tank is full, you might not need to be regassed. However, if your tank is almost on zero, you're going to run out of gas. Very good analogy on what's happened to men who have testosterone deficiency called hypogonadism. So be tested with a specialist and find out if it's the cause of your decrease in libido. Some men have premature ejaculation, meaning they go into sexual activity, they don't last more than a minute. Could be a psychological cause. It could be because their erection is not solid enough. It could be a hormonal imbalance. Could be a variety of things. This is part of sexual dysfunction in the male. It's an ejaculatory disorder. Some men feel they can never ejaculate. They can't ejaculate. They have sex, they might have pleasure, but they never ejaculate. That is a problem. But for now, let us focus a little bit on the most common cause of sexual dysfunction in the male, which is the inability for the penis to become hard. So this is a model of a penis, very flaccid, and it's impossible to make it erect. So that is the problem, is that they cannot penetrate the vaginal canal because they have a floppy penis. So a floppy penis, they're stimulated, they want to have sexual activity. No matter how much stimulation they have, the penis remains limp and it becomes a problem for them. So this type of sexual problem can be addressed, it can be treated, and it can be managed. However, it's important to go to the right doctors who routinely evaluate and treat men with sexual dysfunction and look at a 360-degree picture of the problem of sexual dysfunction. So this is the problem, inability to make the penis hard. So let's talk about what causes an erection. What allows the penis to become erect? What allows the penis to become erect, it is blood from your body, goes through some blood vessels that engorge two tissues called the spongy tissues. There are two spongy tissues in the penis. Once they become engorged with blood, it's like a balloon. You blow up the balloon. Instead of blowing up the balloon with air, you blow up the balloon with blood. You engorge the penis with blood. So anything which impedes blood flow will cause the penis to become flaccid. Let's talk about what causes the penis to become flaccid. What impedes blood flow? Many medical conditions will impede blood flow. That's what they do. They block blood vessels. They destroy nerves. What are these conditions? Common ones. Diabetes is one of the #1 culprit of erectile dysfunction. So if you're diabetic, you are at risk of developing a flaccid penis, erectile dysfunction. If you have hypertension, you are at risk because not enough blood flow gets to the penis. If you have nerve damage, certain medications, if your testosterone is too low, maybe the nerves don't get stimulated the right way, not enough of blood get in the penis. The secret to getting an erection is to increase the blood flow to the penis. And whenever you increase the blood flow to the penis, you will have an erect penis. It's the blood flow. The pills, the medications, such as Cialis, such as Viagra, such as Levitra you hear about, they have fallen into the category of phosphodiesterase inhibitors. And what they do, their job is to dilate the blood vessels in the penis. Encourage them to stay open. Encourage them to be dilated because they're getting lazy. They don't want to open the gate to the blood flow. That's why these medications often are effective, or for that matter, even some herbal medications which have the properties of dilating blood vessels can be useful. And we're going to do in the future a show about how some herbal medications might have some therapeutic values in helping patients with erectile dysfunction. We're going to take a little break where we'll talk about other solutions to erectile dysfunction in a male, which affects 40 million men in the United States of America. This is Dr. Angelo Gousse. You're back at the Gousse Urology show where we're talking about sexual dysfunction, and we were focusing a little bit on the inability to get an erection. And we talked about in the male, what causes an erection is increased blood flow. Any disorder which decreases blood flow, such as diabetes, hypertension, neurologic conditions, kidney diseases, some medications, change in your hormonal status, change in your exercise status, all these things. Less blood flow, worse erection. Better blood flow, better erection. So many men, to increase their blood flow, take Cialis, Levitra, Viagra, these type of medications, and many times it works for them, although it's a chemical. Sometimes it doesn't work for them, and they're like, what do I do? I've taken all the Cialis I can, I've taken all the Levitra I can, and we all know the effect it has on the couple. When the man cannot have an erection, when the couple cannot be sexually satisfied, all kind of trouble can ensue. So we need to, as much as possible, restore sexual function, sexual happiness, sexual health in a relationship. So restoring erectile function is one of the first steps in allowing the man to really engage in satisfying sexual activity and restore the confidence. Because many men lose confidence and they become depressed even when they have erectile dysfunction. When the pills don't work, you only have two other solutions. One solution is to inject the penis with each time you are going to have sexual activity. They put a chemical in the syringe. It's a chemical called Trimix typically, or prostaglandin. And each time you're going to have sex, you inject the penis with that substance, and in about 10 minutes, then there's increased blood flow because the substance you inject increases blood flow, therefore you get an erection, and that's the way you manage it. It's called penile injection. Many men don't like it because it's a little painful each time. It's not very romantic. Each time you're going to have sex, you got to inject your penis to have sexual activity. And this chemical they give you to inject, you got to keep it refrigerated wherever you are, so it might not be very convenient. Another solution is the vacuum erection device. The vacuum erection device works like this. This is one such device. You put your penis in the vacuum erection device, and then you just suck it. You suck the blood like you vacuum. You create a suction. You create a suction, and the suction, once it's formed, the suction itself will cause rigidity. And once the penis, you've sucked the blood, you see now how it's getting bigger, and then you put a rubber band, at the base of it. You see it's a little clumsy here, and then you trap the blood. So it's called vacuum erection device with blood trapping. It's a solution, not that romantic, but it is a solution nevertheless. So nowadays, we have a better solution. This is the only natural solution there is. Because as you age, you lose your hair, your eyesight gets changed, you have white hair, your face. There are signs of aging. But everything ages, including the penis. So the spongy tissue of the penis starts to age. That's a natural part of aging. It's a process. Different people age at different rate, depending on what diseases they have, what medications they take. So one such solution is to rejuvenate, make the penis young again. Now there's available, using platelet-rich plasma, the possibility to make the penis young again. It's called the P-shot, the platelet-rich plasma injection that you can inject in the penis and make the penis young again. Now I will explain the process. The first step of the process is they draw your blood. Just the same way they draw blood when they're doing labs. You go to my office, I take a needle, I personally draw the blood myself. I will draw your blood and I will process it. Once the blood is drawn, what I'm looking for is a cell in the whole blood called the platelets. The platelets are known biologically to increase growth factors. Growth factors allow new tissues to grow. Creates a new, better, young environment of nerves, of blood vessels, of vasculature, of collagen to come and allow the spongy tissues to work better. So it rejuvenates it, it makes it young again. So once I take the whole blood, it goes into one of these canisters. I centrifuge the blood, the whole blood that I got from your arm. It's in a special machine which spins it very fast, 3,000, 200,000 rounds per minute. And then after we centrifuge it, we get the red cells out. We do not need the red cells because the red cells have oxygen in them, and we don't need these oxygen, we don't need the red cells. We separate the blood and we extract what is called the platelets and the plasma. The plasma is the salt and water which suspends in the blood. Your blood has two components. It has the red cells and it has the plasma. So this is the plasma with the platelets. So there is part of the plasma that is platelet poor. It doesn't have a lot of platelets. It looks like that. So if it looks like that, it doesn't have a lot of platelets, but it does have the serum. The part we're interested in is the platelet-rich plasma, PRP. That's why they call it PRP. The PRP stands for platelet-rich plasma. This is a syringe which has the good stuff. It has the platelet-rich plasma in it. This is the magic solution. It's not only used in urology. It's not something magic. It's not something I invented. For many years, doctors, physicians, clinicians have been using platelet-rich plasma to rehabilitate the shoulders. They inject it in the shoulders. They inject it in the knees because it regenerates the shoulders and it helps cure shoulder pain. They inject it even on the surface of the heart when they do heart surgery. They inject it in the hair to regenerate blood flow to the hair. And there are a lot of applications of this platelet-rich plasma for regeneration of tissue. Injecting it directly in the penis is another application of platelet-rich plasma. It's a natural application of the platelet-rich plasma. And what we do, I numb the penis with a little cream, and I inject lidocaine anesthesia. This is the lidocaine, the anesthesia, same one when you go to the dentist, a little prick, and then I numb the entire penis with one little prick. And you don't feel a thing when I inject the penis just like that, okay? I take the penis, I inject the platelet-rich plasma. It's your own blood. I extract the platelets to 9 times the concentration of platelets. 9 times the concentration, because the platelets are the cells which promote regeneration. So you need 9 times the concentration of platelets, and you inject it in the penis, and I inject it at 4 different locations. In addition to that, I inject it on the tip of the penis. The platelet-rich plasma is injected on the glands in addition to the corpora. It's a procedure that took exactly the amount of time I just showed you here. It takes 5 minutes or less to inject 4 times in the shaft and 1 time here. All the other work is done in the laboratory, in my lab, in my office, while I'm preparing for you your personalized platelet-rich plasma. It is prepared for you. It came from your own blood, and I prepare it myself. No one in my office prepares the platelet-rich plasma. I prepare it. I don't buy it. I make it myself using an ultra-fine, refined type centrifugation technique, and the platelet-rich plasma is injected. Now, it's important to know that it doesn't work immediately. You have to wait approximately 2 months for it to really gain its effect, and it lasts in your body for up to 2 years. And 85% of patients will have significant improvement in their erection ability after the P-shot platelet-rich plasma. Last but not least, and we'll talk about it another time, is the inflatable penile prosthesis. This is the last resort. It's a surgery where I put an implant inside of the penis, that inflates saline, salt water, and it makes the penis hard. This is a surgery, and I could tell you it is almost always effective in every single case. However, it is a surgical intervention, and I strongly encourage most of my patients to exhaust all the other treatments we talk about before we proceed with the surgical intervention of the inflatable penile prosthesis. So these are the options. These are the advices that I have for you, ladies and gentlemen, on sexual health from Dr. Angelo Gousse, your friend, your urologist from Gousse Urology.
Cindy. I'm studying to become an English teacher, and I love Island TV. Why? Because we are the Caribbean. We are Island TV. We need to reveal our fundamental contributions in America. We need Island TV to reveal our different beautiful Caribbean cultures for the world to respect and understand us better. Grow your business while supporting the only Caribbean television station in Florida. Advertise with Island TV.